So, do you feel like there's an issue with him possibly taking his medication or overusing it for alternative purposes, such as to get high?
I think that he's taking his meds to school and he's selling it to other kids.
Okay.
Because I cut him off, like I said earlier, from his monthly stipend,
Okay.
and he has no other means of getting money to get extra stuff he wants to do.
Okay.
So I think he's doing that.
All right. So it definitely seems like there may be some issues with the use of his medication then. What symptoms does he experience that you have witnessed or that he has reported to you concerning his mental health diagnosis with the depression?
Well, since he's depressed, it's some days when I'm off, I have to, beg him to get out of bed. He doesn't want to get out of bed.
Mm-hmm.
Sometimes he be in his room crying,
Okay.
and it's really hard to, get him out that funk. Like, usually if he's, up to it, we go laser tagging. It's on the fun to get him out the house. Like sometimes he doesn't want to do that. That's one of his favorite activities we do together.
Okay. And so you said that he's taking Prozac 25 milligrams. Is that right?
That's correct.
Where was he treated to be put on this medication? What's the name of the company that treated him?
Triage Mental Health Center Services.
Okay, Triage Mental Health Center Services. Okay. And how long was he receiving treatment on this medication?
For about 2 months.
Okay. All right. And was the medication and treatment beneficial in your opinion?
I believe it was, and I just think that he definitely was. He had a lot more energy,
Okay.
and and he wanted to do stuff more. But with some of those medicines, some of the side effects can be kind of horrible a little bit. But you have to take the good with the bad.
Okay. So I just kind of want to review with the medication since it's such a significant part of his previous treatment with mental health. Um, just want to review. So you say that he was taking 25 milligrams of Prozac, and that was his daily treatment.
Yes, ma'am. Once a day.
So once a day for his dosage. And you did get the appropriate effects with that medication, right?
They told us the effects, but
I mean, I want to discuss where the effects beneficial. Did he see a decrease in the depressive symptoms?
I did.
And you did as well. Okay.
Mm-hmm.
And what about the side effects? Were they bearable?
Well, some of them were bearable. I mean, one night I had to sleep in the same room with him because he thought that no birds were pecking at his window out to get him. I just told him that he just having nightmares.
Okay.
I think that's part of the medicine. Or
So you believe that to have been part of the medicine?
yeah.
Did the doctor say that would be part of the medicine?
He didn't say that specifically. He said sometimes you can go into a little, disorientation, and that kind
Okay.
of could have been it.
Okay. Um, and did these side effects last long?
Maybe about 3 days.
Okay. Okay. Did you go back to the hospital for additional treatment based on that?
I called a nurse, and the nurse said that was completely normal.
Okay.
About some of his meds, and of course, he's a grown boy, 6'5", and his appetite definitely, picked up a lot.
Okay, with the medication.
Uh-huh.
All righty. Okay. And I just want to ask this: does your son have a history of suicide risk or homicide risk? I know that that's a pretty tough question to ask any parent, but if he's experienced some mental health issues, I definitely want to screen that to make sure that that's not something that we're currently dealing with at the moment.
Um, I think on the anniversary of his mom's death,
Okay.
at school, he threatened to cut himself, and
Okay.
he took him out you know out of the class, and they called me. I went to the school, and I explained to the social worker and the therapist there that what happened, and he started seeing a school counselor,
Okay.
and it's kind of hard though because he go to a private school, and he's one of the popular guys on campus.
Okay. So I really want to talk a little bit. He did see the counselor. And was there any Was he referred to a mental health hospital?
Yeah, the triage.
Okay, and so that's when he got the medication. All right, that's understandable. So it seems like we have that clarified up. And then in the last 3 to 5 years, has your son experienced any mental health crises? And I would define it as, the suicide would definitely be one of those where he was speaking of suicidal ideations within the last 3 to 5 years. Did that event happen within that time frame? It seems as if it may have with the loss of his mother.
Yeah, it has, because it lost his mother, and he said he wouldn't be with his mom.
Okay. So that was definitely a yes to he has experienced a mental health crisis. I want to ask this question. Does your son have any expressed feelings of guilt or anger, in your opinion? Or what you can detail?
I think he carries around some anger.
Okay.
And that's why he plays football, and they have a healthy way to release some of his anger. But sometimes he gets to go to anger around the house if I have a disagreement with him, and he might punch the wall.
Okay. Does your son what is your reaction when he has those anger outbursts?
I just tell him to calm down. Let's go outside, talk about it. And he said he doesn't want to go outside. He punches a wall.
Okay. Do you feel like he de-escalates quite easily, or is it a little difficult to get him to calm down?
It's very difficult to calm down.
Okay, very difficult to calm down. Alrighty. I want to ask, we have been talking a lot about the loss of your wife and his mother, and our next question is, does your son have a history of trauma that you're aware of? Would you consider that to be a traumatic experience for your son?
Definitely. He was in the car, so that's definitely traumatic. He was trapped in the car and had to get the jaws of life.
Just to get him out. So you definitely feel like that is, one of his major issues and points of trauma.
Yeah, like to this day, when we come home from school, I can't take that direction because it just triggers him so much.
Oh, okay. So not being able to take a specific route to and from home because of the incident. Mm-hmm. That's understandable. That's something that we can definitely work on here. Has your son engaged in any threatening behaviors or physical acts of violence?
No.
Other than just hitting the wall towards people?
He got in a fight at school one day.
Okay.
And I had to go up to the school and they threatened to expel him.
Oh, wow.
But like I said, I know the guy who runs the program, give him scholarships, and I told him that we do anything. And basically, he's really on his last leg.
Oh, wow. Okay.
So, he did community service.
So definitely this is an opportunity for him to try to get it together to do better and, stay at the school that you have him placed at.
Mm-hmm.
Okay. Is there any family history of mental health or substance abuse issues? If so, can you list these problems? I know you reported that his mother struggled a little bit with alcohol.
Yeah, she's actually going to 12-step program.
Okay.
And she be with her A group, once a week. And
so she was actively seeking help for these issues.
Uh-huh.
Is there anyone else or any family history of substance use or mental health problems other than this one instance with your child?
My wife also suffered from depression also.
Okay, so his mother suffered from depression. Okay. And is there anyone in the family currently seeking help for any emotional problems or behavioral health issues, similar to what your son is experiencing?
Not that I can recall right now.
Okay, so not that you can recall. All right. So I just want to go over what we talked about with the mental health assessment here. Your son is currently taking Prozac, 25 milligrams, but that there was some issues that you may have seen with him possibly taking his meds and giving it to kids as a way to earn money as you cut off his stipend. And that he did have some mental health crises in which he threatened to harm himself and was, talked to with the school counselor and admitted into the Center for Services in which he was put on the Prozac. You did identify some traumatic events, especially as it concerns the mother's death and him being trapped in the back of that car, and also not being able to take the route to and from wherever he's going which is the route that had the trauma had occurred. And then you say that he does have some history of rage and anger with punching the holes in the wall, but that he also did get physically violent with a child at his school. And that there does also seem to be a family history of substance abuse issues and mental health, in which the mother did suffer from depression and alcoholism. Is that all correct that we've talked about today?
It sounds correct.
Okay, but right now you said there's no one seeking any help for emotional behavioral health issues other than your son and your family, right?
Oh no.
Okay. I want to ask, can you identify at this time any family or community support established to help your son with his issues?
Well, since we all here, we found a good church home, a good family, and
Okay.
the pastor's really supportive about substance abuse and treatment. And
Mhm.
he was the one actually, you know, he lives like 2 doors down from us, and he's actually told us to come to church, and we've been really going there. So he has a good support system with the faith based background. Excuse me.
So you're definitely identifying church as a positive community support for him.
Mm-hmm.
Okay. Does he have any supportive peers that you can think of?
He has a little friend named Elliot, but he doesn't like hanging around Elliot because he says Elliot loves a square.
Okay.
And he rather hang around his football buddies than Elliot.
Okay. I know. Do you identify Elliot as being a supportive peer?
I think so because doing times when they have to study for finals, something like that. I always see Elliot in my house studying, and I
Okay.
know for sure Elliot is going the right direction.
Okay. And what about his football peers? Do you see them as being a positive influence?
Some of them are, some of them aren't. Some of them guys, just want to party, smoke weed. They think that's going to get them into school or whatever. And this is a prep school, so.
Okay. And how would you describe his relationship with his peers? Do you think it has been pretty positive?
He's positive. Everybody loves him.
Okay.
Teachers say he's enjoying having class.
Okay. But specifically with his peers, do you feel like they've developed a pretty positive or negative relationship?
Well, definitely a positive among the male peers.
Okay.
But some of the female peers don't really like him. And that's the person he got to fight with was with a girl. So it's pretty.
He got into a physical altercation with a girl.
He just pushed her against the locker.
Oh, okay. Alrighty. Okay. We would definitely look into that concerning safety here in our clinic, because we do have female clients here as well.
Yeah, one of the things I watch for y'all to work on with his anger, because he's so quick match with it.
Okay. And I want to talk a little bit, since we are a substance abuse clinic, I want to talk about, has the individual's drug use interfered with any of these relationships, whether they be with, his peers or any family support or anything, or has, his drug use increased with any of these peer relationships?
I think when he comes home from football games, he definitely has. He's so quick to go over his friend's house, and that's why he gets most of his drug and stuff from.
So are you kind of saying that some of the negative peer influences may be due to the increase of the use?
Yes, ma'am. Excuse me. Sorry about that.
That's fine. Do you feel like you need to take a break or anything?
Oh no, I'm just really tired from work and stuff. So it's
been a pretty long day.
Yeah.
We're gonna muster through the rest of these questions and definitely give you guys a break. So we'll get through the rest of these and we'll get you guys to a break. I know it can be a pretty long process. I have a question. Does he belong to any clubs or organizations? I know that he's really ingrained in the football sports at school. And so that's kind of an organization for him.
Yeah, off season he's part of the debate club.
Okay, football and then debate club.
Mm-hmm.
All right. And in your opinion, are these a source of enjoyment?
I think he likes debate club, and I forgot one. He's in the church choir also. I think he loves to sing too.
Okay, so you did mention that earlier that he's really great at singing. So,
Hmm.
the choir is a source of, and you think that provides a source of enjoyment for him?
Yeah, because I never see, when he's in singing the choir, I don't see a big
Kool-Aid
smile on him.
smile.
Yeah.
That's good to hear. Can you describe your son's leisure activities? I know that he's playing football. It seems like he's in choir and debate as well. Is there anything else that he likes to do?
Um, Video games, and he likes to play Facebook and cell phone stuff, and he also likes to I bought him a chemistry set when he was 9. That's why he wanted to be a um,
Doing
microbiology. So he
microbiology.
still does a lot of little stuff like that in the house.
So little experiments, you think? Okay.
Uh-huh.
So he definitely has some positive leisure skills I see, other than the substance abuse. Concerning physical health, is there any major health issues or risks, that you may be aware of?
Not really, because he takes care of himself in football, and he only had like one concussion last year, and he's really safe about that because I know it's a big thing now, concussions in football. So we're really on the safe side with that.
So he did experience a concussion?
Yeah, once he just got his, as the old folks say, he got his bell rung.
Okay. Does your son have a primary care provider?
Yes, Dr. Thomas Klossmeyer.
Okay. Dr. Thomas Crossmeyer?
Yeah, Klossmeyer.
Klossmeyer. Okay. Is there any way we can get a consent from the primary physician before you guys leave today?
Oh yeah, I could call his nurse in the office and I could talk to him about it because I talked to him last week when he had the checkup appointment and then he's gonna bring him to rehab.
Okay. So we could definitely get that consent. That'd be great.
Mm-hmm.
And is there a family history of physical health issues?
Oh no.
No, nothing that you're aware of. Nothing major. Okay.
Mm-hmm.
All right. We're gonna go ahead and continue. We're getting towards the end here. I want to talk a little bit about your son's early childhood. How would you describe, his friendships when he was younger?
Well, before we lived in, moved from New York to Kansas. Well, from New York to Kansas City, he really loved, hanging around with his friends in the neighborhood, playing basketball. Chase each other around, playing hopscotch. Just doing what kids do, playing in the neighborhood. And he really had an awesome childhood.
Okay.
Just outside neighbors, that type of stuff.
So you would describe it as being pretty positive, pure supports. Okay. And you said earlier that he's a really smart kid. So we'll talk a little bit about how would you describe his current educational experiences.
Well, when he was I think he was in the 8th grade. I'm sorry, he was in 7th grade, and the teacher said he's really really bright, and she suggested he just skipped up a grade because he was so material. Okay. So we gave him a test, and come to find out he had an IQ of 130.
Okay, that's great. Are there any issues though that you may suspect with current issues right now with him being in high school? Do you feel like there may be any educational issues?
No, not really.
Okay. So otherwise, he seems to really have it together educationally. And so right now he's in the 10th grade, so that's the highest level of education the highest level of education he's completed is the 9th grade. Okay. And you said he's not currently employed, so he has no employment opportunities right now on the table. Okay. I want to talk a little bit about a relationship and home life. Is your son currently in a relationship?
Well, he has a little girlfriend. But he has a lot of girlfriends.
Oh.
So
okay.
There's more than one girl.
So more than one girl that you have seen.
Yes.
Okay. So you can't really be sure about any definite romantic relationships in his life right now.
No.
Okay. So you said that there's more than one girl. So how would you describe your son's relationships with these women or these young girls?
He called them study partners, but I know what time it is.
So okay. So you do believe he may be sexually active?
Oh yeah, he is. I found condoms.
Okay. So he is sexually active, and with him being sexually active, you're saying that his sexual preferences are concerning the hetero. He is heterosexual.
Yes, he is.
Okay. So Okay. So I want to talk a little bit about his relationship with you in the home. How would you describe your relationship with your son right now?
I would say right now it's kind of stoic.
Okay.
So it's just like he only comes down when he wants food or money,
Oh,
or asks me
wow.
can he go somewhere else. And actually, want to go to activities, he say f off.
No.
So it's really kind of stoic, you know.
Okay. So would you describe it as being pretty distant right now as
Yeah,
well? And you just it seems as if he treats you as if you're just meeting his basic needs, it
yeah. It's
seems.
just like he just living with me for the time being until he goes off to college.
Like a kind of like a roommate almost, not
Yeah,
more like a father and son.
yeah. I want to get back to that, but I think I might change my work hours so I can spend more time with him.
Okay. So that seems like something you're willing to do.
Oh yeah, most definitely.
Okay. Can you tell me about how your son's use has affected you?
Devastated.
Okay.
Hurts my feelings. Um, I just wish he didn't do it.
All right. So you definitely feel very concerned and hurt. Are you a little fearful as well?
Yeah, I don't want to get that phone call saying your son, is dead.
Okay. So it seems like you're devastated, you're hurt, and concerned and fearful. I
Hmm.
know that's what you reported earlier in the pre-screening as well about the fear. Can you tell me a little bit about that?
Well, my biggest fear is I get a phone call saying my son died of an overdose,
Hmm.
or
Is that what you were thinking had happened?
yes.
Okay. So definitely fearful of possible death with the lifestyle he's living.
Hmm.
Okay. Um, I want to talk about religious beliefs. You brought that up earlier that you guys got into a really strong faith-based church. Um, and so it seems that you guys seem pretty partial to your religious beliefs. If so, how can this be a strength in your son's recovery?
Well, I just think if I could expand on my faith base, I think that if we could have Christ in the center of everything, he could be all right.
Okay.
And we're Nazarene, and we want the best for what our son. I'm saying not our son. I'm sorry, just a little tired.
Mm-hmm.
I want the best for my son, and I want him to succeed. And the pastor and the youth kids really love him there. So I think that our faith background is gonna be good.
So you think that'd be something he can use in the recovery to kind of rely on when things get hard or difficult to work through?
Yeah.
Okay, that's understandable. We have some final questions to sum up, and then we're gonna go ahead and talk about treatment recommendations before we close. So we're definitely getting ready to bring the session to a close here. Um, in your opinion, what is your desired goal for your child's overall therapeutic
I
experiences
want him to. I
here?
want him to be clean and sober, so that way, if if these issues arise in the future, he can be able to use his coping skills and whatever treatment plan he has to say no to him,
Okay.
say no to drugs.
All right, so you definitely want him to just get that sobriety under his belt to continue to make strides and success here.
Mhm.
What are some? I know we talked about some strengths here. Do you have anything else you want to add concerning his strengths to be able to make it through a program such as this?
I just think that he's a smart kid. He put his mind in anything, he's gonna
Achieve it.
achieve it.
So you believe he's very motivated to achieve success.
Hmm.
Okay. And you mentioned earlier using coping skills. Are you aware of any effective coping skills your son engages right now?
He loves his chemistry set, so he might go home. If he having a bad day at school, I can see him in the kitchen, or not the kitchen, but the little game room, and he's in there playing with his chemistry set.
Okay. So, the chemistry set is pretty much a pretty good coping skill to get him to calm down and focus.
Yeah.
And then you set the game room. So is there anything in there that helps maybe a coping skill for him?
Well, he has the video games, like I said earlier. That he plays the
Okay.
game, and he also watch movies in there. So it's like pretty much a little game room, rec
Okay.
room.
So he seems like he can focus a lot of energy into video gaming and his interest in chemistry to kind of calm down and focus on what's going on.
Mm-hmm.
So this final question here. Despite coming in to address personal issues, what is one positive thing in your son's life that you believe that he does well?
I think he focuses on his goals and he achieves them.
Okay. So he's great at focusing on goals and meeting those goals.
Yes, ma'am.
So he's great at goal setting, in your opinion, too?
Yes, ma'am.
Okay, goal setting and achievement. I will note that. All right. Well, I want to thank you for coming in today to talk to me. I know this has been a difficult subject matter, and I don't know what it's like to be in your shoes, but I definitely want to do what we can to help you here. There's some treatment recommendations that are a little bit of preliminary, as he does still needs to go through the assessments and get the formal diagnoses, but I do see us recommending him for residential treatment here. Our residential treatment program is about a 45 to 60-day program. And within that program, they get individual counseling needs, they get case management needs for community resources. They also get their co-occurring disorder needs met, so COD. They also get their trauma needs met with therapy. And there's also some family therapy that can help you guys with some communication barriers that you seem to be experiencing within the home. In addition to that, we also can give you resources as well so that you can prepare him for transition and that he can prepare for transition as he goes back into the home as well. At this time, do you have any questions concerning the recommendations, any concerns you may have, anything you want to state on the record concerning the possibility of him coming in for inpatient, anything you need to discuss with us that may be concerning or alarming to you?
No, I think you've done a wonderful job at giving me all the ins and outs of this program and facility. And I just want my son to be, healthy and sober. And I'm looking forward, for these family therapy sessions and play this well. We can finally be able to bridge that gap. I just want my son back.
Okay, and I definitely hear your concerns. Well, at this time, if you don't have any further questions, we can go ahead and step in the hallway. And what I'm going to do is give you some resources. I'm going to give you some pamphlets on AA meetings and NA meetings, sometimes that you could probably go into Al-Anon to discuss what it's like to have these experiences with your son, with people who too have struggled with these issues as well. And I just want to give you guys some supports to work with at home when he does return to the home environment as well. So we have a lot of resources we can give you, and phone numbers that you can call to get additional support. And if you also need different psychiatry, as I know that the other psychiatry you haven't had much contact with, but we would like to give you guys some resources for psychiatry as well to make this as positive and a seamless transition as possible. So if you don't have any more questions, we can go ahead and step out into the hallway. It was really great meeting with you today. I hope you have a great day.
You too. Thank you for your time, man.
You're welcome. All right, we can go in the hall.